Marie, I'm gonna do your head to toes.
First, inspect the head, making sure that it's round, there's no areas of bulging, indentations anywhere. All sides look equal, and that looks good. And then I'm just going to palpate the head itself, feel any lesions, making sure that the scalp is freely movable, no areas of hard nodules anywhere. I'm also just going to feel the hair while I'm here, making sure that it's smooth, any coarseness or fineness. Just going to first inspect the head, making sure that it's round, there's no areas of bulging, indentations anywhere. All sides look equal, and that looks good. And then I'm just going to palpate the head itself, feel any lesions, making sure that the scalp is freely movable, no areas of hard nodules anywhere. I'm also just going to feel the hair while I'm here, making sure that it's smooth, any coarseness or I'm going to start by looking at your eyes. They are symmetrical. The eyelashes extend outward. The eyebrows extend evenly. I'm just going to shine my pin light here and look at the conjunctiva of the eyes. So if I just have you look, stare straight at the object on the wall, and I'm going to just look at your pupils and how they react. I'm looking at the direct and the consensual or constriction. Do what we call a cover and uncover test. So I'll have you cover one eye, just stare straight ahead at a fixed point. Now uncover that eye. All right, now cover the opposite eye. Now uncover that eye. Great. Now just making sure the eyes move together. Have you follow the end of my pin light here. Just kind of keep your head still. Gonna look at the cardinal vision of gaze. So just gonna leave your head still. Now just making sure that her eyes move evenly together. There's no jumping or nystagmus. And that looks good as well. So next we're going to just look at the ears. Just going to, again, just inspect the ear, make sure the shape is normal. There's no skin tag, no lesions anywhere. So palpate the ear. So again, feeling for any hard nodules. And that looks good as well. We're going to look. Going to measure your hearing. We're going to do what we call the Weber test. I'm going to strike the tuning fork and place it to the top of your head. Let me know if you hear the sound in your right ear, your left ear, or both ears. Okay, so you know what you hear. Both ears, that's good. Now we're going to do the REMA test, and let me know whenever the sound disappears. Okay, I'm going to strike the tuning fork and put it on the mastoid bone. Okay, now let me know when it disappears again. Okay, and that's just comparing bone conduction versus air conduction. And then I'm also going to do a whisper test. So I'll have you cover one ear, and come behind you, and just one mouth. And I'll whisper a word, and you would just repeat it back to me.
Coffee.
Okay, now you cover the opposite ear. Okay, great. The whisper test is in act.
T.
Tea.
I'm just going to now go on to the mouth and just inspecting the mouth, looking for symmetry. There's no lesions, there's no cracks in the creases of the mouth. The lips are full and pink. And I'm I'm going to palpate the lymph nodes. So we're just going to start here at the preauricular area. Again, feeling for any nodules that are freely movable or hard nodules. Going to the post-auricular area, back of the neck at the occipital. We're going to come up to the chin, the submental, and then look at the submandibular along this edge. Going to go down both sides, feeling the post-cervical chain. Going to feel a little deeper for the deep cervicals, and then the supraclavicular lymph nodes. Then I'll have you kind of put your arms out to the side. I'm going to feel here for the axillary lymph nodes as well, and all that looks good. And then while I'm here, I'm just going to do some range of motion on your neck. So I'll have you kind of, just going to start by inspecting the respirations, making sure they're even, unlabored. We're going to look from both.
Will you write it?
Oh, I'm sorry.
And then while I'm here, I'm just going to do some range of motion on your neck. So I can have you kind of put your ear to your shoulder, and your opposite one, and put your head up and back. Okay, very good. And then we're also going to assess some of the cranial nerves. So next we're going to move down to the chest. We're just going to start by inspecting the respirations, making sure they're even, unlabored. We're going to look from both sides, just making sure that, again, there's no one area worse, stronger than the other, and it looks very nice and even. The color looks good. It's nice and pink and warm. There's no visible lesions or rashes that I can see. I'm just going to also start by palpating the precordium. I'm just going to feel here for your heart, just feeling for any thrills, heaves, palpitations. And we're going to go right under here. That's good. And then while I'm here, I'm going to feel for the apical pulse, which is about 5th intercostal space in the clavicular line. Again, feeling for rate and rhythm, and to see if it is in midline and not deviated to the side. And I'm going to now listen to the heart sound. So I'm going to start here in the aorta. Just going to listen for the S1 and the S2, making sure the rate is regular and rhythm. Going to go over here to the 2nd intercostal space, left sternal border, listening to the pulmonic area. Okay, going to go down to the tricuspid area and the Erb's point. And then I'm going to listen to the mitral area, the 5th intercostal space, mid-clavicular line. Okay, and all that sounds really good. And then while I'm here, I'm also going to listen for your carotid pulses. So I'll just do one at a time. I'm listening with the Bellman stethoscope for any. So I'll just go on both sides and have you just take a nice deep breath in and out. Go ahead, take in a deep breath. And out. And I'm listening at the lung field to make sure that there's no crackles, wheezing, any bronchi, making sure that the sounds are appropriate and that they're even on both sides. And I'm going bilaterally to each side to compare each lung field as we go. While I have you here, if I can have you put your arms out to your side, I'm going to compare the lateral aspects of the lungs as well. So I'll start over here. cleanly and non-labored. The skin itself looks good, but there's no rashes, there's no lesions, sores anywhere. And then we're also just going to start by auscultating the lungs again. So I'll have you again taking a nice deep breath in and out. And I'm going to compare both sides evenly. And again, listening for any crackles, wheezes, rhonchi. You should hear nice clear breath sounds throughout the entire lung field. Working my way down all the way to the bases of the lungs. And one more over here. And then I'm also going to measure how well the ribs and the thoracic cage expand. So I'm going to put my thumbs here together, and I'm going to have you kind of put your arms across your chest and lean forward a little bit, and taking a nice big deep breath, and out. I'm just making sure that my thumbs move evenly here, and that one side is not pulling more than the other. And that's very good. And you can go ahead and turn to the front. We're now going to go on to the skeletal and the skin. So I'm just going to have you bring your arms out here. I'm just going to inspect the skin itself, looking for any, again, lesions, nodules, any rashes. And I'm going to look here at the fingernails. We're going to do a capillary refill. Just going to briskly press on the nail bed, looking to see that the blood comes back. Capillary refill of less than 3 seconds. And that looks good on both hands. I'm going to palpate the pulses on here. So we're just going to actually start with the carotid and work our way down. So I'm going to feel the carotid pulse on one side. And resistance. So if I can have you put your arms out, just kind of hold them steady there. I'm going to push down, and if you could just resist my push. Okay, and I'm going to push up, and if you could resist it. Good. Have you bring your arms out to the side. I'm going to push down again. Okay, and I'm going to push up. Very good. So you can relax your arms. So we're going to go down to the lower extremities now. Again, I'm looking at the skin, making sure that there's good color, any hair distribution. There's no areas of edema. I'm looking at the along the edges of the tibia here for any pitting edema. I'm looking again at the toes themselves, doing capillary refill, making sure that it's good underneath 3 seconds. I'm going to feel behind the knee for the popliteal pulse on the right side and then on the left side. And then I'm going to have you just bring your foot up here. Lift up your shirt just a little bit. And again, I'm just going to start by inspecting the skin. I'm going to lift up your shirt just a little bit. And again, I'm just going to start by inspecting the skin. I'm going to shine a light down evenly with the skin, checking the contour. There's no areas of visible herniation, no protrusions anywhere. The skin itself looks healthy. There's no rashes, scars, and lesions to the skin. And we are going to begin by auscultating the bowel sounds. We're going to listen to all 4 bowel sounds for up to 2 minutes if I don't hear anything. Listening to the right lower quadrant, listening for gurgles, any areas of hyperresonance, hyperactive bowel sounds, hypoactive bowel sounds. Listening to the right upper quadrant, moving over to the left upper quadrant. And now, Betsy, I'm just going to start by percussing. I'm going to feel the liver borders themselves. So just go ahead and just relax and breathe normal. Just going to feel here and listen to where the sound changes. I'm going to mark the edge where the liver border changes. I'm going to go down. And again, mark that edge, and there's the edges of the border of my liver, which is within defined limits. I'm then going to percuss the spleen. And again, listening for any sounds of dullness, hyperresonance. And Betsy, if I could have you roll to your side. For the spleen, you kind of want to have the patient lay to their side so that they can, you can get a good angle of the spleen itself. And that sounds good as well. You don't want to feel this. I'm just going to do a general percussion over the rest of the abdomen. Again, listening for any sounds of dullness or hyperresonance. Any areas where there could be fluid buildup or masses underneath the skin. And that sounds good as well. And now we're just going to start by a light palpation. Just going to kind of feel, let me know if you have any pain. I'm feeling to see if there's any nodules, any masses, any lumps that I can feel. I'm feeling in all 4 quadrants. I'm going to palpate here for the liver. Kind of feel the edges of the liver, making sure that it's not enlarged. And then I'm going to palpate the spleen. And in doing this, I'm going to put my hand underneath her and kind of push forward and palpate for her spleen, which a little deeper palpation to kind of feel the organs themselves and again feel for any masses or lesions. I'm going to go a little deeper here. Any pain or tenderness? Again, that looks really good. So we're done with the abdominal assessment. If you want us to sit up here.